Today let us discuss about the respiratory hygiene or respiratory etiquettes. Respiratory etiquettes are nothing but to prevent droplet infection or to prevent the spreading of the respiratory associated pathogens or respiratory associated microorganisms from one person to the another person. We follow some of the respiratory etiquettes. The first and the foremost respiratory etiquette is cover your mouth while sneezing and coughing. Cover your mouth while sneezing and coughing. Either by using the upper arm sleeve or by using the napkin, you will have to cough on it and throw it immediately after you use. And have hand wash immediately if in case you are exposed to the respiratory secretions. The first one is cover your mouth while coughing and sneezing, but not with your hands, because if we cover by using our hands, there is a chances of transmitting the disease caused pathogens, because with the same hand there is an opportunity to be used on the other equipment, right? For example, I coughed on my hand. I will just go and hold some equipment or instrument with the same hand in hurry without having hand wash, right? So instead of using your hands, you use your upper sleeve. After using your hands, after coughing by mistakenly on your hands, have hand wash and use napkins or towels to sneeze it, and after sneezing it, don't use it, throw it in the laundry bag, or if in case if it is paper towel like what is that called, tissue paper, well and good, we can just throw it in one use. Okay. And in case for the tuberculosis patients, what do you mean by tuberculosis? It is a highly contagious respiratory disease. Can we contact with the tuberculosis or TB patient directly? Can we contact him directly without wearing mask, without wearing PPEs? No, because his secretions are very contagious. To avoid that one, what we will have to use means, while in case you are taking care of a TB patient or tuberculosis patient, you should wear N95 mask. N95 mask is having 5 layers, which prevents the transmission of microorganisms. Right? We'll have to wear N95 mask before entering into the tuberculosis patient's room. And respiratory patients, those who are suffering from the respiratory infections, will have to isolate. What do you mean by isolate? Keep the patient in a separate room. Keep the patient in a separate room to prevent the spread of the microorganisms to the other patients or to the healthcare givers. To the other patients or healthcare givers. And we should maintain positive pressure in the particular room. Positive pressure in the particular room of a TB patient. What do you mean by positive pressure? The positive pressure is nothing but, for example, this is normal room, right? When we open the door, the inside air can go outside, right? To prevent that movement of the air from in to out, we are maintaining the positive pressure in the respiratory infected patient's room. By that, the air inside doesn't go outside and causes the spreading of the microorganisms, right? And the next one is, do not expose to the respiratory infectious patients until unless you wear a mask. Even after attending the patient, for example, you went to the assist the respiratory infected person, immediately come after, you should have hand wash and remove your mask and wear the another mask before you are going to the another patient. Before you are going to the another patient, you should have hand wash and wear another mask. However, this is not allowed because in the hospital setup, if isolated patients are there, only one or two particular nurses are allotted to look over that patient only, and there is less chances of getting exposure the same staff nurse to take care of the other patients. This is how we'll have to prevent the respiratory infections by maintaining the respiratory hygiene. And another line of the prevention of the infection is when the respiratory infected person is used the sputum cup. I shown you sputum cups, right? So for example, he used the sputum cup to spit it in. You should disinfect it before using to the other patient, and you should not directly expose it to that sputum. And before throwing the sputum, you should disinfect the sputum by using the sodium hypochlorite solution 1%. Before throwing infected sputum, we should disinfect the sputum. Disinfecting of sputum is nothing but we are considering sputum. In sputum there are microorganisms, right? To kill that microorganisms, we use a chemical. We use a chemical that is called as disinfectant solution. That may be sodium hypochlorite solution or hypochlorite solution. These solutions you won't be knowing now. When we go to the clinicals, I will tell you in detail. Okay? So by using that solution, we'll have to disinfect. Why we are disinfecting? To prevent. We throw in the basin. So in that same basin only other patients will have hand wash, or they may use to clean some utensils. There is a chances of getting this infection transmitted to the others. Or if we go and throw in the yellow dustbin, so the 4th class employees, they doesn't know that is infective material and they don't know how to handle it. So we have to disinfect by using the chemical to kill the microorganisms. By that we can prevent the microorganisms spreading. Okay, fine. Now let us discuss about the handling of the sharps. What do you mean by handling of the sharps? What are the things that comes under the sharps? Comes under the sharps: needles, surgical blades, needles, and all other sharps, broken glasses. But broken glasses we can just throw in a blue dustbin. Okay, especially we think of needles and surgical blades. Needles and surgical blades causes percutaneous injuries. What do you mean by percutaneous injuries? They can pierce into our skin and causes injury. But why let it cause? What is the problem? The problem here is if you expose it to the sterile one, there is no problem. But when you used after on a patient, for example, we used a needle or surgical blade on a HIV patient or HBS patient. What is happening? On the same syringe, unfortunately, it poked us, it pricked us. What happens? The microorganisms are there on the needle, right? Or the microorganisms are there on the surgical blade, and that may enter into our bloodstream or blood circulation and cause the disease condition or infection. This is how most of the healthcare workers and healthcare employees are getting cross infection while they are treating the patients. By mistakenly or fortunately or unfortunately, they are getting infectious because of these percutaneous injuries caused by the infected or contaminated needles or blades and sharps. To avoid that one, what precautions we have to take? The first and the foremost precaution that we have to take is we should not recap the needles. After using, what we do, our mistake is we try to see, this is needle and we try to use the needle used on a patient. So we try to recap it and by like imbalance and we poke, right? And to avoid that one, we should not recap it. We should remove this needle and throw it in a dustbin. That is called a puncture-proof container. Puncture-proof container. In a white plastic bin, it is filled with the 1% hypochlorite solution, and in that bin we will drop it. One thing. Otherwise, we can burn the needles by using the needle burner. Second thing. And the third thing is we can just bend it. We can just bend it by using the force and throw it. But this bending technique is nowadays they are not following. Otherwise, if you really wanted to recap it, you have to use the scooping technique. We have to use the scooping technique to recap the needle. Keep the cap under a surface but not on your hand again. You should not keep this cap of the needle on your hand. Keep under a surface and try to scoop it just like this. Scoop it and press it. Right? There is a less chance of getting injury. This is called as scooping technique. This is called as scooping technique. By using the scooping technique, you can recap the needles. It is all means like we should not recap, but in case if you really wanted to recap, for example during the surgeries, so if you don't recap, there is a chances of you are pricking into the needle, and in between the surgeries you are not allowed to throw the things because it may require in between the surgery. In that way, then you will have to just recap it. But there are very less chances of pricking the needle while we are removing it because the force is opposite to the needle, right? Understood? These are all with the safety precautions with the sharps regarding the needles. But with the surgical blades, while removing the surgical blades from the instrument, you will have to use either a artery forceps. For example, consider this is a BP handle. Surgical blade is there on the tip, and you will have to remove by using the artery forceps or an instrument, but not by using the hand. That may again cause you the percutaneous injury. And after removing, collect in a bowl and throw them in a puncture-proof container. Throw them all in a puncture-proof container. That's how we can prevent the sharps injuries or needle stick injury. In case, for example, you exposed to the needle stick injury, what do you have to do? Put the finger in the mouth. Should we put our injured finger into our mouth? No, because our mouth does have 80 pairs of microorganisms. Do you know that? Our mouth is having 80 pairs of microorganisms, and again it may cause another further infections. To avoid that one, you should not put your hand in your mouth, injured hand, and do not panic. Go and wash under the running water and with the soap. Do not squeeze and make sure that which needle is pricked and what is the condition of the patient to whom you have used the needle, particular needle, and come and inform to the in charge and inform to the infectious control nurse. By that they will give you the prophylactic treatment. What do you mean by prophylactic treatment? Prophylactic treatment is nothing but even before diagnosis. For example, you pricked to the HIV patient infected needle, but sometimes you may not know that you got like HIV because HIV symptom period is 6 months to 1 year. So before that only they will start you giving medication, antiretroviral therapy, to prevent the safety measurements, to prevent the infections. That is called as prophylaxis treatment. Prophylaxis treatment.